Hello, Ms. Jones. My name is Cathy. I'll be your student nurse today. I'm going to go ahead and do some hand hygiene for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I'm going to go ahead and identify you, Ms. Jones. Your name is Sally Jones and date of birth is January 1st, 2001. Perfect match to the wristband. Do you have any allergies, Mrs. Jones? No. And are you experiencing any pain? No. Patient's general physical condition is good and patient is not in distress. Today I have an order to insert a urinary catheter because you have urinary incontinence. Have you ever had a urinary catheter inserted before? No? Would you like me to walk you through the steps? Yes. So what I'm going to do is insert a urinary catheter into your urethra, and when you urinate, the urine will collect in the bag. And what I'm going to do is clean your genital area, and then I will insert the catheter, and I'll get a urine sample, and then I will stabilize the catheter tubing onto your upper thigh. How does that sound? Good. You might experience some discomfort, but it shouldn't cause anything. Do you have any questions or concerns for me? No? All right. Begin hygiene for 20 seconds. For my supplies, I have a fully equipped catheter, I have a CHG wipe, I have a sterile 10 ml syringe, I have a stabilization device, I have clean gloves, sterile gloves, towel, a bucket of soap and water, a dry towel, check, and a warm blanket. And hygiene for 30 seconds. I'm going to go ahead and put on some gloves and clean my table for 30 seconds. One, 2, 3, 5, 7, 9, 11, 13, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm gonna go ahead and let my table dry for 2 minutes. And hygiene for 20 seconds. 2 minutes has passed. And hygiene for 20 seconds. I'm going to put on some new gloves and place my supplies. I'm going to go ahead and drop in my 10 ml syringe. And I'm also going to drop in my CHG wipe. Hygiene for 20 seconds. I'm going to close the patient's curtain for privacy and hygiene for 20 seconds. I'm going to put on some new gloves. Ms. Jones, for this procedure, I'm going to put you in a supine position, and I'm also going to take your blanket off as well. All right. Here is a warm blanket for the procedure, Mrs. Jones, and I'm going to place a cup underneath you. All right. And I'm going to position your legs in a froggy position, Ms. Jones. Any pain or discomfort? No? All right. Ms. Jones, I'm going to lift up your gown now, and I'm going to clean your genital area. Wipe. In the middle, another middle, outer, and outer. And I'm going to pat dry. All right, and I'll cover you up again, Ms. Jones. And hygiene for 20 seconds. I'm going to lift up your gown again, Ms. Jones. and hygiene for 20 seconds. I'm going to go ahead and put on some sterile gloves. I'm going to place my sterile drape, no touch technique. All right. I'm going to take the plastic off of my catheter, and I'm also going to insert catheter into the loop. I'm also going to attach my syringe to this port, and I'm going to loosen my specimen cup. I'm also going to open up my iodine swab. All right, Miss Jones, I'm going to now clean your labia. One swipe in the middle, one swipe outer, and one swipe outer. And take this away. All right, Miss Jones, I'm going to insert your catheter now. I want you to take a deep breath in for me, and then I want on the count of 3 blow out. And when you blow out, I'm going to insert your catheter. All right, deep breath in, 3, 2, 1, blow out. I see some urine, so I'm going to advance 1 to 2 more inches. And I'm going to inflate the balloon. All right, and I'll tug gently, and I feel resistance, which is good. I'm going to go ahead and kink my tubing. And then I'm going to grab my CHG swab, and I'm going to scrub the hub for 5 seconds. 1, 2, 3, 5. And I'll let that dry for 5 seconds. 1, 2, 3, 4, 5. I'm going to place my syringe and get 8 mils of urine. And I'll place this back onto a sterile part of my surface. And I'm going to unkink the tubing. Any pain or discomfort, Miss Jones? No? All right. Hygiene for 20 seconds. I'm going to go ahead and put on some new gloves, Mrs. Jones. Now I'm going to stabilize your catheter. I'm going to use the clip to secure the extra tubing. And I'm going to make sure there's enough leeway. And I will stabilize the catheter onto the patient's upper thigh. There's enough leeway. Perfect. I'm going to cover you up, Miss Jones. And I'm going to hang the bag on the frame of the bed below the patient's bladder, and there's no kinks in the tubing. I'm going to dispose my supplies. All right, Miss Jones, I'm going to place your legs back into position, and I'm also going to take this chuck out of the way. Would you like to keep this blanket, Miss Jones? Yes? All right. All right. And thank you for 20 seconds. I'm going to go ahead and put on some new gloves. And I'm going to open up the cap facing up. And I'm going to aseptically insert my urine into the cup, and I will slowly, and I'm going to close it, and I'll write the name, date, and name of the patient, date and time, and the MRN, and send this off to the lab. I'm going to dispose this in the receptacle and holding for 20 seconds. All right, Ms. Jones, I finished inserting a urinary catheter. How is the procedure for you? Good. Any pain or discomfort? No. All right. So when you urinate now the urine will collect into the bag. Do you have any other questions or concerns for me? No. All right. So here's your call. Please let me know if you think of any other questions later, and I'll lower your bed and I will go document now. Thank you, Ms. Jones. And hygiene for 20 seconds. Sally Jones. Catheter was inserted on April 22nd at 2 p.m. The urine output was 500 mils, yellow and clear, no odor, no sediment. The size 16 French catheter was used, and the patient tolerated the procedure without any complaints or complications. Thank you.
Hello, Mrs. Jones. My name is Cathy, and I'll be your student nurse today. I'm going to go ahead and do some hand hygiene for 20 seconds. And I'm going to identify you, Mrs. Jones. Your name is Sally Jones, and your date of birth is January 1st, 2001. All right, matches your wristband. And do you have any allergies, Mrs. Jones? No. And are you experiencing any pain today? No. All right. The patient's general physical condition is good. They are not in distress. I have an order to remove your urinary catheter today. Have you ever had your urinary catheter removed before? No? All right. So what I'm going to do is I'm going to remove the stabilizer from the catheter, and then I will take the water out from the balloon and then remove your catheter, and then I will take the stabilization device off of your thigh. And it'll cause some discomfort, but it should not cause any pain. Do you have any questions or concerns for me? No? All right. And hygiene 20 seconds. For my supplies, I have a 10 ml syringe, I have some clean gloves, a chuck, and a warm blanket. I'm gonna close the patient's curtain for privacy, and hygiene 20 seconds, and clean gloves. Ms. Jones, I'm gonna put you in a supine position for this procedure. And I will take your blanket off. All right, and I'm going to place a chuck under you. Okay, and I'm also going to put, here's a warm blanket for you. And I'm going to position your legs into a froggy position. Any pain or discomfort, Mrs. Jones? All right, I'm going to pull up your gown as well. And hygiene 20 seconds. Place my syringe. And hygiene 20 seconds. It's on. All right, Mrs. Jones. I am now going to remove the stabilization device off of the catheter. All right. And I'm going to take the syringe. And the water out of the balloon. Right. That into the chuck. All right, Mrs. Jones. I'm going to now pull out your catheter. I want you to take a deep breath in for me and then blow out. And when you blow out, I'm going to remove your catheter. All right. Deep breath in, blow out. How's that for you, Mrs. Jones? Any pain or discomfort? No? All right. If there was resistance, I would attach the syringe and take out more water from the balloon. But if there's still more resistance, I would leave the catheter in place and contact the healthcare provider. Any pain or discomfort, Mrs. Jones? No? All right. Take this. This here. And I'm going to cover you up, Miss Jones. I just have to remove the stabilizer from your thigh, and I'm going to dispose that. Right, Miss Jones. We'll put your legs back into place. Thank you. I'm going to pull your blanket up. Are you comfortable in this? And would you like to keep this warm blanket? All right. I'm going to bring my bag, the bag to the bathroom, and I would measure the output in a graduated cylinder, and I would take note of the color. It would be yellow and clear, no sediment, no odor, and then I would dispose this in the proper receptacle. Hand hygiene, 20 seconds. I'm going to raise your head of the bed a little, Miss Jones. Any pain or discomfort? No? All right. So that was, I remove your urinary catheter. And then please let me know the next 2 times you void so I can measure the amount of urine and make sure you are urinating properly. And you may feel some burning and stinging sensation, but it should go away with the next few voids. And if you experience any pain or blood in your urine, please let me know so I can contact your healthcare provider. Do you have any questions or concerns for me? No? And how is the procedure for you? Good? Any pain or discomfort? No? All right. So here's your call light, and I'm going to lower your bed. And I will go document now. Thank you, Mrs. Jones. And hygiene, 20 seconds. The patient's Sally Jones urinary catheter was removed on April 23rd at 9 a.m. The urine output was 500 milliliters, and it was clear yellow, no odor, no sediments. Later, I will document the next 2 voids, and I will document the measured amount and the characteristics of the urine, the color, odor, sediment, and then the patient tolerated the procedure without any complaints or complications. Thank you.